Good afternoon. It is 4 o'clock, the time we come together Monday through Thursday. That's a little better. Good afternoon. It's 4 o'clock, and that one wasn't Kenneth's fault. It's the time we come together every day at 4 o'clock to get an update on our battle against COVID-19, get an update on some other things going on in Kentucky. Today, first, I am representing Randall K. Cooper High School. Appreciate Michael Wilson, their principal. They are in Union, Kentucky. Thanks for putting out your mask to protect your students. Today, we're going to go over our Fast Four at 4. Then we're going to have Amy Cubbage give an update on unemployment, especially the extra $400 that the federal government has authorized, but talk through how it only authorized those dollars to a limited group of people, smaller than those that qualified for the $600 extra assistance earlier. I think that created some confusion. It is all a matter of federal law, where other than authorizing the program, we don't have any say in that. And then we will give the COVID report. Dr. Stack will once again insult Germany and Canada and New Zealand, and then we'll take questions. That was all sarcastic. Fast Four at 4. First, this month is Manufacturing Month. October is officially recognized as Manufacturing Month in Kentucky. While it's one thing to issue a proclamation, which I do each year, it's another to truly recognize how profound an impact manufacturing has on Kentucky's economy, its communities, and its families. Think about this. Manufacturers in Kentucky employ about 260,000 Kentuckians, all full-time. 260,000 full-time jobs for Kentuckians. That is an outsized number. More than 13% of jobs in our economy are in manufacturing versus a national average of 8.5%. Kentucky's home to approximately 4,500 manufacturing facilities, from Fortune 500 companies to mom-and-pop operations. We produce dryers, aerospace composites, dump truck bodies, laundry baskets, concrete blocks, duct tape. We produce duct tape. Pet food, construction, cranes, cars, trucks, and SUVs, cheese, craft beer, railroad ties, running shorts, and so much more. And this year, approximately 100 facilities use their manufacturing expertise to make PPE. Our manufacturers stepped up when we needed them the most, and they were there for us. These companies make barriers, masks, gowns, disinfectant, face shields, intubation boxes, ventilator components, and of course, a whole lot of hand sanitizer. PPE producers and their employees are true heroes in this epic fight against the coronavirus. It's important to note that even through COVID, Kentucky has continued to work hard to attract new manufacturers, grow our existing one, and increase wages across the board. Since the onset of the pandemic in March, we've announced the planned creation of 2,000 plus jobs and more than $630,000 in investment by manufacturers throughout Kentucky. That represents a significant portion of over 4,300 manufacturing jobs newly announced since my administration took office in December. These jobs come along with approximately $1.25 billion in planned investments across 113 projects coming in the next few years. The investments by these manufacturers will bring economic vitality to communities in every region, from Fulton County on the Mississippi River to Boyd County on the West Virginia-Ohio border. I'd like to say thank you to all our manufacturers and to their employees. This story of Team Kentucky, of fighting an international pandemic, and thus far doing better than most, has come down to all of us sacrificing and all of us stepping up when we need it the most. Our manufacturers surely have. Second, Homeland Security grants. Today, we're announcing $3 million in Homeland Security grants that will enhance the safety and preparedness of 25 communities across the Commonwealth. The funding comes from the U.S. Department of Homeland Security's State Homeland Security Grant Program, and it helps local governments prepare for and counter acts of terrorism. In the COVID-19 pandemic, it's taught us that the value of being prepared can be the difference between life and death. These much-needed grants will help Kentucky communities plan for, respond to, and recover from events that we pray will never happen. This year, Kentucky's Office of Homeland Security will administer $3,084,888 of these grants to the city and county governments, school districts, hazardous material teams, emergency medical services, law enforcement agencies, and an area development district. So grants were awarded in 5 categories: cybersecurity enhancement, including election security, emergent threats, soft targets, crowd spaces, including election security, communications, and first responders. Those receiving awards included Marshall County Fiscal Court, Jeffersontown, Johnson County Fiscal Court, Pike County Fiscal Court, Hart County Fiscal Court, Butler County Fiscal Court, Paducah, Lexington-Fayette County Urban Government, Georgetown, Trimble, Davis, and Lyon County Fiscal Courts, the Lyon County Board of Education, Louisville Metro Government, Cumberland Valley ADD, that's the ad district, Paintsville, and Hallsville. I want to thank all of our Homeland Security officials and experts for what they do. And let's remember, while we have been focused on COVID-19, and we face other crises like our drug crisis, domestic terrorism has been on the rise in this country. It is one of our greatest security threats, and we know that not only can be in the form of individuals, but also hate groups that are out there, and they're in this state too. So thank you to all of those working in Homeland Security to try to make sure that terrible events don't happen in Kentucky. But when they do, we respond appropriately. All right, Kentucky Tourism, stay close, go far. That's the new marketing campaign for the Kentucky Department of Tourism, which is the perfect message as we stay in Kentucky to protect ourselves and those we care about during COVID-19. Through this ad campaign, we want to encourage Kentuckians to safely experience adventures here at home while helping our economic recovery by pushing our dollars into our own tourism businesses. Road trips are a great way to explore the roads less traveled and explore the unique experiences right here in our own backyard. Kentuckians can also learn about history and the beauty of the Commonwealth, which is a perfect adventure for kids still doing online instruction. Kentucky is a versatile destination. We have lakes, mountains, forests, bourbon distilleries, historic battlefields and sites, horse farms, unique cities and towns, and so much more. We encourage Kentuckians to stay close, go far, and find a new place to explore close to home by following along with Travel KY Road Trip. I can tell you that my family and I have been venturing out and experiencing Franklin County, whether it is a battlefield site from the Civil War, which we climbed up to here in Frankfort that most don't know about, or I didn't, to the Josephine Sculpture Park, which we went to here this last weekend. They are great family outings, and they impact the local economy. Mask Up KY. Both Dr. Stack and I are going to talk during the COVID update about how we have to step up our mask wearing. But while we talk about that, sometimes we don't give credit to those that are doing such a great job and are doing the right thing every time. So first, on today's winners, which we will be reaching out to and offering one of our Team Kentucky masks, we have Ashley Adams, who is masked up and casting her vote. Remember, this week is your last time that you can request an absentee ballot. You put up the deadlines. Make sure you get online and request your absentee ballot this week. If you're concerned about COVID, you can request it by October the 9th. And if this has come in the mail, make sure that you fill it out appropriately. There is an internal envelope and an external envelope. So you have to fill out your ballot, which is 2 sides, right? You put it in the envelope, seal it, but then you have to sign the inner envelope. You then put it in the outer envelope, which you also have to sign. We want to make sure your vote counts, So you got to fill out your ballot, seal it in the inner envelope, and sign the inner envelope. Seal that in the outer envelope and sign the outer envelope. We will go through this again, but the most important thing for you to do is get online, request your absentee ballot, and I would say that if you're requesting it now, you very much want to consider putting it in a drop box as opposed to just putting it back in the mail. I want to thank Ashley Adams, if we go back to that, for doing 2 civic duties, wearing her mask and voting. That's a twofer. All right, next. This is a group here in Louisville that is offering a generous match gift challenge last week, dropping off a bunch of their clients' daily need items to help those who need it during this time of COVID. Again, they're doing 2 great things here. They are wearing a mask, which helps their fellow human being, their neighbors, and they're helping their fellow human being and their neighbors. All right, and finally, this is pretty special, and we appreciate her willing to share this. So this is in the Kenton County School District, but this is Amanda talking about Kay. Kay is disabled and doesn't like to be touched, but they worked with some incredible therapists and wonderful teachers in the Kenton County School District for over a month so that she could mask up. And I want you to read this next part and keep her classmates safe. If she can do it, you can do it too. Think about all the excuses that some make to not put on a mask. Then think about Kay. Think about all the people around her. Think about what this means. If Kay can do it, you can do it too. All right, next up is Amy Cubbage. Amy is going to give us an update on UI. We're going to start using here forward 2 podiums that we have here in the rotunda. It's another effort for us to space out and to ensure that we're following all the best protocols. Oh, okay. We're going to use 1 podium today, and we will switch to 2 podiums tomorrow. Where are you, Kenneth?
Good afternoon, and as the governor said, I'm here to give an update on unemployment insurance. Just so that we all understand the constraints that our Office of Unemployment Insurance works under. This is essentially a federal program. There are some state statutes that apply, but we are bound by federal rules, whether we're talking about traditional unemployment and definitely when we're talking about pandemic unemployment assistance, the additional $600 that was paid earlier in the pandemic, as well as the lost wages assistance that's being paid through FEMA. So while we would love to be able to pay everyone who needs it, we have to abide by the rules that are set in place. And just so you have a little bit of a gauge of what we're talking about, just for the pandemic-related programs, I have a binder in my office that's this thick, and I add to it at least once a week with new guidance from Department of Labor. So this is something where we have to abide by the rules. So unfortunately, we can't pay everyone. And just so people understand some various reasons why you might not qualify for unemployment insurance under the traditional program. If you voluntarily quit your job, you're not going to qualify for unemployment. If you're terminated for misconduct, you would not qualify for unemployment. If you didn't have sufficient wages in the prior 18 months, unfortunately, you will not qualify for unemployment. That's because it's an insurance program. So it's very different, and if you haven't dealt with unemployment before, you would not probably understand that it's not something you automatically qualify for if you're out of work. On top of that, not everyone who is out of work right now qualifies for the backup pandemic unemployment assistance program that was set up in the CARES Act. Obviously, there's base eligibility criteria related to the pandemic, but unfortunately, fear of getting COVID is not enough to qualify. That is specifically given to us from the U.S. Department of Labor. If you have a doctor's note that says it's not safe for you to work during the pandemic, that would qualify you. But if you simply feel like it's unsafe for you to work outside the office, without that doctor's note, we cannot approve a PUA claim. Straight from Department of Labor. Inability to get a job because of the pandemic is not enough. Quitting because of lack of COVID precautions at your employer might be enough, but that would be subject to a fact finding. And again, if the employer is abiding by CDC and Healthy at Work guidance, then we couldn't approve your claim even if you were not comfortable with what your employer's doing. So there are a lot of rules that we have to abide by in approving claims and also in investigating the claims, because all of these reasons we just talked about would give rise to something called a disputed claim. And I know I've talked about before how those disputed claims both require a fact-finding investigation and then that determination letter. So all of these reasons are why you might not have seen your unemployment claim approved yet, why you may not have seen your letter, because it just takes a while to sort through all of these things. And just for some comparison numbers for you, as far as how many people get denied, we are actually denying fewer claims during the pandemic than we were before the pandemic. Our pre-COVID numbers over the year prior to the pandemic, about 34% of claimants did not qualify for unemployment. Right now it's down to about 25% because of some slight loosening of the restrictions. And that includes the PUA claims. Our eligible claims payment rate is level with the pre-pandemic numbers, which is about 80%. That means about 80% of the claims that can be paid have been paid. And there could be various reasons why a claim hasn't been paid. It could mean that you didn't request your payment, and even though you were eligible, you might not have requested it properly. We might have to get wages from another state, or we might have to process overpayments and offsets. So there can be a lot of reasons why that 20% haven't been paid. But just so everyone knows, the Office of Unemployment Insurance, though it was hit with record numbers of claims, has paid in excess of $4.1 billion in benefits to date to Kentuckians. And those benefits get spent in our economy at all of our small, medium, and large businesses, and they have an economic impact multiple times more than that $4.1 billion number. A couple of other notes before I talk about lost wages. There have been some periodic system outages the last couple of weekends, and including yesterday. That's been due to some server issues. Please be patient. We understand that that is difficult for you if you're trying to get on and request a payment, but we're working through them, and we will attempt to keep the system up as much as we can in light of those server issues. We know a lot of people are starting to run out of initial UI benefits since those only last for 26 weeks. There are extended benefits available, and there is now a video on the website that will explain how to apply for those benefits. So if you go to the kcc.ky.gov website, you can see that video and see how to apply for those. We are still assessing the feasibility of reopening in-person services through the career centers or otherwise. We hope to have more information on that possibility soon, but of course some of that will be dependent on how we do with fighting COVID here in the Commonwealth. Now on to the lost wages assistance through FEMA. And I know right now that is the source of the majority of the questions we get regarding unemployment. We know it's a very confusing program. It's confusing for not just the claimants, it's confusing for the states. In fact, a few states have either not paid out any dollars yet because it's so confusing. I believe New Jersey is in that position, and Florida cut off the program early simply because it was so difficult to manage. But so far, we have made the initial batch of payments for all 6 weeks for claimants who had already certified their eligibility. Those were for weeks ending 8/1 through 9/5. The last payment, the last week's worth of payments for those claimants was processed last night, so that should be hitting bank accounts in a couple of days. We've paid out now $245 million through the Lost Wages Assistance Program, and that includes Kentucky's CARES Act portion, which is a quarter of that. Just please understand, though, this is a unique program. This is nothing like the $600 a week top-up that we had earlier in the pandemic that anyone who qualified for any unemployment program could receive. This has specific requirements that were laid out by President Trump in his presidential memo and as well as through FEMA. We're not used to administering unemployment programs through FEMA. So this is a completely new go-around both for unemployment and for FEMA. So it's not subject to the same rules that even those who understand unemployment are used to. The rules in the presidential memorandum were that you had to have at least a $100 weekly benefit amount, and that's the benefits you're entitled to, not what you actually receive after offsets, and that you have certified that you are out of work or you have reduced hours because of COVID. It's not the same as the prior $600 payment. The eligibility certification is what we're getting so many questions about. Just so people understand, since sometime in May, all claimants, when they request their payments, have been able to provide a certification regarding being out of work because of COVID. Now, if you are a traditional UI claimant, if you skipped that question, it wouldn't have stopped your payments. If you were a PUA claimant, it was required. So for some large universe of our claimants, we already had this certification. Since we had that, we made the decision to go ahead and push out the LWA payments to people who had already certified, so we could get the money to you quicker and into our economy more quickly. Now, there were a group of about 21,600 people who were UI claimants who had not given a certification, either yes or no. For those on September 28th, we have sent you an email that told you you need to log into your claim, and the moment you log in, you are forced into a certification page. About 15,000 of those 21,000 have already now provided that certification, either yes or no. If you said yes, we have to check in a couple of weeks, make sure that we have all the money we need from FEMA, and then we'll pay those claims out if money is available. If you either do not certify or you certified no on those questions, you will get a letter from us. Those letters are starting to go out today. It will be a denial letter, but it will give you appeal rights. Once you get that letter, you have 15 days to file your appeal. So if you believe you should have gotten an LWA payment and you didn't, be on the lookout for that letter. And exercise your appeal rights if you'd like to. And then if you have an additional question, we have added an FAQ section on the kcc.ky.gov webpage for you to read up on that. So just in summary, please remember the feds set the rules on these. We don't. We very much want to help you, but we're constrained with what the federal rules are. Do you want me to go ahead and do the questions we had? We had gotten some submitted questions from the media, so on UI, I'm going to go ahead and briefly address those. I know this has gone for a while. We got the question, as always, how many claims are still not processed in the system, wanting to know why they are not processed yet. Are they under investigation? Not enough staff? What are the main problems? This is the same thing we have discussed multiple times. We've had over 1.2 million claims filed into a system that is not made to handle that kind of volume. Anytime we try to bring in additional staff, though it is often helpful, this is a highly technical area. It's hard to get very many staff up to speed. So we're never going to have the kind of staffing that would allow us to process that quickly. Now, as of October 5th, we have about 77,000 unresolved initial claims. The most of those out of that 1.2 million are going to be disputed claims. So that's what's taking a little bit longer on those claims. We're still working hard. Ernst & Young is working hard to get those taken care of, but it will take some time. We got a question that many people told us that the state had accidentally sent out the extra $400 to the wrong people and is waiting to correct those accounts to show there was an overpayment before the correct people received the payments. Can you please advise? There were about 7,000 claimants with the first week who did get an overpayment of that $400. They will get an overpayment notice, but that has not hung up the payments to other claimants. So other people who were certified did get their payments notwithstanding the overpayments. Why are the remaining claims taking longer to process? Is there a timeline on the backlog, and what's next for people who didn't receive their $400? We've addressed the timeline issue, but again, for the people who didn't receive the $400, please be on the lookout for a denial letter, and you can appeal that denial. And it said, it looks like there's only one office open for in-person help, which is in Frankfurt, and everything is booked through the end of the year. Is that accurate? Weren't there a few offices reopened for in-person help? And if so, why were they closed again? And when will more appointments become available? Unfortunately, our Frankfurt office is booked through the end of the year. We hate that we can't give more in-person appointments right now, but our staff, both for safety reasons and for efficiency reasons, are going to be faster working in the office. Like I said, we are looking at options to try to expand that.
Thank you, Amy, and we are fully committed to reopening regional unemployment offices. Our challenge right now is we have been able to see, even with the same employees, the number of claims they process when they're in the office in Frankfurt right now versus the number when they're doing in-person visits outside, and it would reduce the speed at which right now claims are being processed. With the amount of claims, we need to get to a steady point before we can absorb that loss of productivity, because that would be fewer people each week being helped. Let's go to our COVID report. I want to start by showing that same chart that we showed yesterday that shows that we are experiencing an escalation, our third major escalation in this COVID crisis, and it is significant. So last week we had 6,126 positive cases, and we are on pace to have more than that this week. But yesterday, when I said more cases equal more people we lose, I want to bring that home a little bit. In the United States, there's a 2.8% mortality rate for people who contract COVID. I'm proud in Kentucky, we've got some great doctors and nurses and healthcare workers. We're at 1.7%, 1.1% less than the national average. But 6,126 cases of COVID-19 with the mortality rate we have would be 104 Kentuckians just from last week's cases that we will lose. That is 1 week. And it shows you how quickly the number of people that we lose can accelerate. It gives you an idea when you saw 14,000 cases in Florida, similar in Texas, why they had to bring in the freezer trucks, because they were running out of morgue space. We must act, and like Dr. Stack will talk about, it's not about new steps, though we will take them if we have to. We saw with the last escalation that we have the power to stop it if we simply do what we know works, and that is wearing a mask, engaging in social distancing. And if we are honest with ourselves, we know that fewer people are wearing masks right now than they were when, in July, when we took the steps on the mask mandate to stop that escalation. We are re-upping that mask mandate for another 30 days. I don't think that's a surprise to anyone. And it falls within the recommendations of the new White House report that we received, I think, this morning. It comes out either late on Monday or early on Tuesday. I want to read a sentence from the Trump administration that is in this report and the recommendations to show you that, folks, this isn't political. It just saves lives. This is their words. Masks must be worn indoors in all public settings. Masks must be worn indoors in all public settings. That's from the White House. And group gatherings should be limited. Those are two major steps we took in July. Those are some steps we need to get back to following on a high level. The White House is also showing certainly more counties than in the previous week or weeks in the red zone, the orange zone, and the yellow zone. Look at how many extra counties, and this is the White House's numbers, shows you that COVID is not Democrat or Republican, it's just a deadly virus. And the numbers are the numbers. We can calculate them differently. We can set red and yellow and orange differently, but it still shows that a lot of our counties are really struggling. So we look at the red zone, and I think we have about 24 counties that are on here. And that lines up pretty closely with our incident map, which I think has right around 20 this week. Then we have the orange zone, which is just one level below that is more than just caution. It shows you that you are in danger and you want to avoid being in the critical level. And then there is the yellow zone, which again, isn't a go, it's a pause. It is really think about what we ought to be doing and to do it better. Had a call with county judges and mayors today. Talked with them about the importance of both being leaders at the state and the local level like they have been. Like they have been pushing really hard, but needing to redouble our efforts in messaging in our specific communities, but also in the enforcement. And that we as leaders need to make sure that if we go to a retail establishment and people aren't wearing masks, that we say something to that establishment. On the state level, we're going to be stepping up the enforcement, and so for our businesses, cannot check people out who aren't wearing a mask. No shoes, no shirt, no mask, no service. You can blame me for it. It'll make it a lot easier. But please, we need to take this step so that your business is not impacted on a more difficult level. Fed chair from the Federal Reserve is also out today talking about how important this is. And this is somebody entirely separated from the political realm, but talking about our economy, which I hear so many people talking about, wanting it to improve. We do too. This is Federal Reserve Chairman Jerome Powell, and he said at the National Association for Business Economics annual meeting the following: a second wave of the coronavirus could more significantly limit economic activity, not to mention the tragic effects on lives and well-being. This part's important. Managing this risk as the expansion continues will require following medical experts' guidance, including using masks and social distancing measures. He also said that aggressive stimulus by the federal government is needed, and without the support, we could have a, quote, weak recovery, creating unnecessary hardships for households and businesses, and thwart a rebound that thus far has progressed more quickly than expected. So, what does that mean? It means every federal health expert has said you have to wear a mask. And the White House is saying wear a mask. It means that the state health experts say you got to wear a mask. And the state governor is saying you've got to wear a mask. And economists are saying that you have to wear a mask. So we need you to put it on so that we can help stop this escalation that we're seeing. We can save lives, protect our economy, and keep our kids in school. Remember, more cases mean more red counties in the incident map, which impacts both school and sports. So it's in our hands to ensure our kids have these opportunities we want them to have. Now let's make sure our hands grab a mask and put it on our face before we go out in public. Today's daily summary says we still have a lot of work to do. Today we're reporting 1,054 new cases of COVID-19. That's more than any Tuesday in the last 4 weeks, including the highest 2 weeks on record, which have been in the last 2 weeks. 144 of that 1,054 are kids under 18. We still see a significant percentage of our cases being children. Our total number of cases, 74,194. Total number of tests still up over 1.5 million, 1,552,667. Currently hospitalized, 592 Kentuckians. In the ICU, 150. On a ventilator, 93 souls that we ought to really be praying for. Test positivity rate is still in a better place, 4.29%, but that's going to be impacted really quickly if we keep having this many positive tests. New cases by county: Jefferson 190, Fayette 185, Christian 31, Davis 28, Laurel 24, Madison and Whitley 24, Henderson 22, Pike and Warren 21, Scott 20, Callaway and Knox 17, Bullitt 14, Carter and Shelby 13, Franklin, Lincoln, Nelson and Rockcastle 12, and Boone, Johnson, Morgan, Pulaski 11, Allen and Clark 10. A lot more counties with single-digit cases. They will be online. Today we've also lost 4 additional Kentuckians: 89-year-old man from Christian, 85-year-old man from Henderson, and a 78-year-old and a 69-year-old woman from Jefferson. It's going to be a hard month with all the cases we've seen. It's going to be a hard October. It's going to be a hard November too, because deaths trail cases. So let's, just like we got to be strong and continue to wear masks, let's continue to have those green lights on. Let's continue to ring our bells at 10 a.m. These are 4 new families that need our help. There's now 1,218 Kentuckians that have died at least in part to COVID. That's a lot of families that are going to be impacted. By now, if you're talking and you're listening to people around you, you at least know somebody who has lost somebody to COVID. This last week, 3 separate individuals I know lost someone they care and love to COVID. If you're listening, it's happening just about every day. And these are people around you that you care about, losing people that they care about. So let's do better. Long-term care facilities: 23 new residents, 30 new staff, 12 new deaths that are attributable to long-term care. K through 12 schools, and this is since yesterday: 40 new students tested positive, 14 faculty or staff, 15 additional schools with at least 1 positive case. Colleges and universities, since yesterday, 108 additional students, 2 new faculty or staff, 2 new universities or colleges with at least 1 positive. Kentucky child care facilities, 7 new facilities with at least 1 positive, 5 new staff, 5 additional children. Now, that means we got to do better, and we got to be wearing masks. But I want to take a minute to talk about the hard work of people who are out there ensuring that everyone has a mask. This week, this last week, I was visited by Gina Hudson of Berea and Lisa Schultz of Somerset, who brought us a quilt that is here in the rotunda that has some real special meaning. This quilt was made from 100 mask makers from all over Kentucky, and these are scraps left from masks that they were making, that there wasn't enough material to finish off that mask. You will see in this quilt pieces of masks that either the First Lady or I wore, never even knowing that they were made by one of these 100 individuals. They are from communities all across Kentucky. The Kentucky Mask Makers Quilt is intended to mark a moment in our history where Kentuckians came together to do what was needed to help one another stay safe and get through this difficult time together. This is symbolic of 100 people who saw how much a mask can help people and got to work. They didn't complain, they didn't push back, they didn't talk about it being inconvenient. They took their own time to protect their fellow human being, not just by wearing one, but by making them for everybody. You know, there's lots of different reasons to wear a mask. Today, I'm going to wear a mask for these 100 patriots. We talk about heroes, we talk about patriots. How about those that are ensuring that everybody out there can have a mask to stay safe? With that, I'm going to turn it over to Dr. Stack, and then we'll come back and answer questions.
Thank you, Governor. Good afternoon, everyone. Today I'll go back to a little bit more my normal style. If we could do my slide. Thank you. You've seen these before. This is from 91-divoc.com. This is a neat graphing website. Arizona's in the orange, Kentucky's in the blue. Arizona obviously got hit hard in the summertime. Arizona hit a peak of about 550 cases per million residents per day. Kentucky had a low plateau around 40 to 50 a day for about 3 months. Then it had an increase. We warned people about that, and then we steadied in at about 150 cases per million per day for a couple months, and now we're in a new escalation, and we're now up at about 200 cases per million per day. And I've raised the concern that when you're running at higher levels, you take off more quickly. You're start at a worse starting point, and so the badness can get bad more quickly. The reason I'm going to do this is I'm going to show you a new study here that came out today, again, from the CDC. Again, a wonderful resource at its best. So if we can show the next slide, please. So the CDC showed today that when they started having their escalation in the summer, and you just saw that huge mountain on the previous graph, they had a marked increase in cases. They immediately took actions and took steps. When they took those steps, they had predictably, in the weeks and months that followed, a profound decrease, a 75% decrease from that peak in their cases. I'm going to show you on the next slide the graph that shows more detail. You won't be able to read these words from home, but I'll just tell you. On the far left, where you see the tiny little bars, that's when they had stay-at-home orders. That's back in the spring when we did healthy at home. We know if we keep people apart from each other, infection can't spread. This just proves that. So they had the same experience there, that when they kept people at home, they didn't have the disease spread. Arizona was one of the states that opened much more quickly and much more fully when we went into the late spring. And then you see this marked surge. When they started opening all sorts of retail stores is at the very beginning there on around June 29th or so, or the end of May, where they started to have an increase. Then they lifted their stay-at-home orders and the closures expired. And that's when you get to about May 15th, and then you start to see 2 weeks after they lifted their stay-at-home orders and their closures, the beginning of their increase, just at the very base of that huge mountain that looks like a skyscraper. As they started to climb up there, when they got to the top near the end of June, and the second half of June, they put in a mask mandate, June 17th. Then they shut bars and gyms and movie theaters and water parks and limited them significantly. And then you started to see within weeks the beginning of a return to a declining trend line. They reduced restaurants to 50% capacity, required social distancing. And then halfway down the slope on the backside, they renewed their limitations in order to continue this progress. And so Arizona, can you go back 2 slides back again? So this slide that I showed here shows Arizona now is doing much better than we are because they put all these measures in place, they controlled the virus. Now the problem is if Arizona removes those restrictions, Arizona is going to face the same challenge Kentucky and other places face. They'll go back up. You can just put it back to the Team Kentucky slide. So my points in showing these slides are, we know what works. I know it's fatiguing. I know that the public's tired with this, but it's a disease that spreads predominantly by droplets, also perhaps by some aerosol spread to some extent, and that was finally acknowledged by the CDC again in their public documents. and also perhaps by touching some things, although that's by far the least of these. We have to take steps to keep ourselves away from each other and to reduce how we're spreading things. Now, some will say, well, there's not as many hospitalizations now as there were per people sick. Well, there's a number of things. First of all, when we were healthy at home, young people were largely at home and they weren't exposed to each other as much. We've got schools open, we've got colleges and universities open, we have all of industry and society open, even if at reduced capacity. People are interacting a lot more than they did before. A lot more younger people are also getting sick now, or infected, and they don't have the same severity or acute severity of disease as the older folks and folks who have chronic medical illnesses. So that would, right there, would drive down the mortality and the hospitalizations. The other thing, there's more discussion that maybe wearing these masks has another benefit, which is if you infect somebody, maybe you transmit a smaller amount of virus to them and you get a smaller dose, and then perhaps the severity is not as bad. So if you're around someone with a big viral load spreading lots of virus in the air, you breathe in a big dose, you get a lot more, if you will, toxin or infection. You could have a much more quick surge in your illness potentially, and you could get worse and have a much worse course. We don't know that for sure, but that's one of the theories people are postulating. So I want to leave you with this thought here. So I've said before, I'm an emergency physician. That's what I've done most of my career. It's only recently when I took this job that had to be on pause because this takes too much time right now. I care about the patients I treat and I take care of in the emergency department, and now as I serve as a health commissioner for the state of Kentucky. I really do care, and I want everyone to have the best chance. But please don't misunderstand caring with not understanding and accepting. People are going to make choices, and bad things may come their way. The challenge here is there are a whole lot of Kentuckians, and I'll just tell you, my sense from the communications I get is well over half. It's not close. It's well over half of Kentuckians who are very concerned about this virus. They understand things like the flu killed 22,000 people last season. COVID has already almost killed 220,000. Any way you extrapolate into this, this disease, COVID-19, is at least 10 times more fatal, than influenza. So more than half of Kentuckians, I'd say more than half of Americans understand it's a dangerous disease, it's risky to play games with it, and they value their lives and they don't want to lose it. So until we find a way to protect all those people from the actions of others, we have to take steps to give everyone a fair shake so that they don't get unwillingly taken down by this when we could have taken steps. Now, if we get vaccines, and vaccines give everybody a chance to be protected if you get the vaccine and stay safe, we're still going to urge these things if they need to be done. But if others endanger themselves and pay a consequence for that, that's your choice, and I'll sleep just fine if that happens. But I want to give you and everyone else the best chance, and we got to protect the supermajority of Kentuckians and give them a fair chance. So again, I want to ask you, please, wear the masks, socially distance, and follow these other guidelines, because they're really simple and they're really low tech, but they actually really work. And if we do all this together, that's how schools stay open, universities stay open, businesses stay open, and people get back to activities. I've said in some of these tweets I've done recently, and I mean it, I really do believe the vast majority of people are good people and want to be heroes in their own lives. They want to be a hero in their own life story. So be a hero, dress like one, wear a mask, and you'll help keep other people safe, and you'll keep yourself safe at the same time, because this thing's like a boomerang. When you take your eye off, it's going to come back and hit you in the head, and some of you are going to face a consequence through your own actions because you didn't wear these. So let's please try to avoid that. Thank you.
All right, we will open it up for questions, and we'll start over here with Nick today.
I know you were able to have a meeting with some community leaders today. I'm just curious to know how that meeting went. What did you all discuss, and what should the public know about that meeting?
Today, I had a Zoom call with our county judges and our mayors, specifically talking about needing their help and continued leadership and encouraging Kentuckians to do what's necessary to defeat COVID-19, to wear a mask, to engage in social distancing. And then I ask for their help in enforcement as well, that they are on the ground in their communities, and really from a local leader just saying something to a manager in a local store or restaurant about, you got to step it up, and every single employee needs to be wearing a mask, and every single customer needs to be wearing a mask, can make a huge difference. Also answered some questions. There are some requests on some ordinance enforcement that I think we can work with folks on. But I think by and large, our local leaders that have been really amazing at responding to COVID see that we are in our third escalation. They have been there before, and our expectation is that they will step up, even though it's hard, and begin pushing and pushing and pushing people the right way. Grace?
I had a follow-up to that. You mentioned questions, ordinance questions. Could you explain what that was? Does that have to do with?
No, there's challenges in local government that, especially early on in the Healthy at Home, and some of the things we put out where we paused some ordinance enforcement so that people wouldn't not get evicted from their home, but face certain hardships. So there was some reasonable requests that we want to make sure that we work through. There's no reason that as long as someone's not in quarantine that they can't cut their grass and not let it get incredibly high. And so we're gonna work through what some of those examples are and make sure that we can provide some flexibility. Tom?
What are some of the penalties that can be put in for violating your mask mandate?
The question is on penalties and I guess generally how we're going to step up our mask enforcement. So first, from the state level, we will have inspectors from the Department of Public Protection, I believe of Labor, ABC, for bars and restaurants, and then there are in some areas local ABC units. What can happen? You can have your business shut down for a period of time. You can be fined. You can just have a conversation where you say, okay, we'll get it done, and we know that you're going to be checking back in. All that is really secondary. The most effective way to get this to happen is to make a commitment, again, that we probably got a little lax on, that you can't be served in a retail or a business establishment if you are not wearing a mask. Again, I know that's a hardship on some businesses that are going to have some people that are angry, but it's not the business's fault. I put the mask mandate in. All they're doing is enforcing it, and they can tell that individual that they need to do that to protect their business. But we need that to happen, because if we keep shooting up, if 6,000 cases is just a middle point to where we are going, those businesses aren't going to have anybody in them. So the customers that they need, the economic activity that we need is all dependent on us stopping the escalation and managing the virus. And again, it's a fact. It's not an opinion. The Federal Reserve agrees. All the economists out there agrees. Goldman Sachs talked about it with wearing masks earlier. You know, when every expert says the same thing, it's a fact, not something for people to argue with.
A couple of hours ago, Donald Trump said he was not going to, or he doesn't want to negotiate COVID relief talks until after the election. He says he wants to focus more on the Supreme Court nomination of Amy Coney Barrett. What are your thoughts on that?
Earlier today, and I didn't see the tweet, I just saw a headline on it. Apparently the president called off negotiations on another COVID CARES Act package, one that we desperately need. This CARES Act package was supposed to help schools as they welcome students back. So now we got the students coming back, but we don't have the federal government funding that they said they were going to step up and provide. Congress was going to consider extending, maybe not at the $600 level, but the much easier extra unemployment program that more people would qualify for in Kentucky than the $400 one, and it's significantly easier to administer. There were talks about state budget and local government budget relief, without which we will have a much slower recovery. Again, that's every economist, Goldman Sachs, and the Federal Reserve. I mean, we're in the midst of a pandemic, and we're going to pause for a confirmation on doing the things that we need to do to help our country. I disagree. We need it now. And I can tell you, for us, we're forecasting what our budget's going to be. And we're going to have to put some hard numbers to that. And every delay that they have creates additional challenges to that, and is likely to create additional cuts as we go. If they can't sit down and agree to a package that helps Kentuckians and helps Americans during this, shame on them. And I don't even see the Senate engaging in the negotiations. Shame on them too. And he did the last 2 hours, and you got the last 20 minutes. All right.
The majority issue was asked about the presidency. Apparently, we have no acceptable agrees with the president's position. When was the last time you spoke to the majority leader? And has he made any promise to you that Kentucky will get CARES Act funding?
So I'm told, and I'll have to go off the representation, that in the last 20 minutes, Senate Majority Leader Mitch McConnell from this state has said he agrees with the president in putting off any package that would help Americans. Well, I just think about every school teacher that is in a building right now that deserves the extra funding they were going to do to keep them safe. And I don't know what the senator or the federal administration would tell those individuals if they get sick in the meantime. It's also hurting the economy, the lack of predictability and stability, and this is their job. And basically it's saying we're not going to do our job because of politics, because of an election coming up. It's your job in a pandemic to put aside the politics and to sit down and to stop being Democrats and Republicans and to get something done. All right, Grace, do you have another one? Okay, Tom? All right. We've done this so much, we've run out of
I wasn't
questions.
expecting it to get to me so fast.
It's like a snake fantasy football draft. It just comes around so quickly.
Might as well pass me over and go to Mike too.
Yesterday, you were talking about the president's diagnosis, and you hoped that he would have come to a moment where he would take the virus seriously. I'm sure you've seen the images now when he returned, hurrying on to the White House, and he made it a point to take off his mask. What was your reaction in that moment, and do you still have faith that the president will start taking this more seriously?
It's questions about the president's diagnosis with COVID and actions really over the last 24 hours, especially right after this press conference yesterday. First, I mean, I wish him and everybody who has COVID a good, speedy recovery and hopefully no lingering effects, which we have seen in some people. And so I don't want that to be questioned. I mean, my faith tells me, regardless of what you think of someone, you always want the very best for their health and their family's health. And I wish that for absolutely everybody out there. So I had a moment, it might have even been months ago, where I was worried that I was exhibiting symptoms. And I remember walking back over to the governor's mansion, thinking about I was about to walk into a home with my family, and committing and even calling over to make sure that they would not be on the floor I walked in, and going to an entirely separate floor, wearing my mask that whole time. It worries me that we saw an example last night of many things, but of somebody taking off their mask while they're infected and then walking into the house with their spouse and kids. Hopefully everybody was, separated and isolated, but when you are still infectious, let's make sure that we set the type of example that will protect other people and other families. And I am sure that some out there will view that statement politically because I'm of a different party than the president. But throughout this, I've shied away from really any type of criticism. We've worked well with the administration. But the time to set the very best example of what people that have the infection should do is a time when the whole world is watching you when you have it. And so again, I hope that he'll listen to his doctors and he'll think about this moment could possibly be bigger from a historic standpoint than any election or re-election. It could be the time that he set the example that saves tens of thousands of lives, that sets the standard for what you do when you have the virus. There's an opportunity for true leadership there that I think people would remember, and I hope he takes the opportunity to show that leadership. All right, folks, let's remember as we finish tonight that it's hard to get around those questions right now with what's going on, but this virus doesn't care about county or state lines, and it does not care about your political party or what you think about me or what you think about the president. It's out there to infect as many of us as possible and kill those that it would kill. This isn't about who's elected, it's about us. And it's about the choices we make to protect our fellow human being. I haven't said it in a while, but this is our test of humanity. How good are we? I believe that we are very good, and we just got to make sure that we stay resilient, we stay strong, and we keep passing that test. We'll see everybody tomorrow at 4.